Hello friends, let's see the most important topic of the upper limb, that is brachial plexus. The brachial plexus is nothing but it is the intermingling of the nerve fibers which are responsible for providing the nerve supply to the upper limb. As we already discussed in the general anatomy of the nervous system, each limbs they are going to be supplied by the ventral rami of the spinal nerve. So this brachial plexus that is going to be formed by the ventral rami of particular spinal nerves. So let's see how the brachial plexus is going to be formed. So brachial plexus is going to be formed by the ventral rami of C5, C6, C7, C8 and T1 spinal nerves. So ventral rami of the C5 to T1 spinal nerves, they are going to form the brachial plexus, and all these are called as the roots of the brachial plexus. Now there are two words, one is called as a prefixed brachial plexus and one is called the postfixed brachial plexus. When we see in some individuals the C4 spinal nerve involvement is there, and in that case the T1 involvement is less, and this kind of the brachial plexus is called as the prefixed brachial plexus. While in some individuals the involvement of the T2 is there and C5 involvement is less, and in those cases it is called as the post-fixed brachial plexus. So the prefixed brachial plexus and the post-fixed brachial plexus, these are the two important words which we can remember. Now let's move on to the origin of the brachial plexus. When we see the origin of the brachial plexus, they are going to arise, as we already discussed, they are from the ventral rami of the C5 to T1 spinal nerves. And while these roots are going to enter into the neck from the spinal cord, it passes between the scalenus anterior and scalenus medius muscle. So the brachial plexus, it arises between the scalenus anterior and scalenus medius muscle. So now let's see the formation of the brachial plexus in little bit more detail. So as we have already discussed, the brachial plexus is going to be formed by ventral rami of C5, C6, C7, C8 and T1 spinal nerves, and all these are called as the roots. The roots of this brachial plexus in a typical pattern, they are going to intermingle with each other and going to form the trunk. So let's draw the trunk with the red color. So here the C5 and the C6 root both are going to fuse and going to form the trunk, that is called as the upper trunk. The C7 root, it continue as a single root and it is called as the middle trunk, while the C8 and T1 both are going to fuse and form one lower trunk. So here we can see these are the trunks. Now this each trunk is going to divide into the anterior division and posterior division. So here this one is the anterior division of upper trunk and this one is the posterior division of the upper trunk, and here the same, the anterior division of the middle trunk and the posterior division of the middle trunk, and here this is the anterior division of the lower trunk and the posterior division of the lower trunk. So all these are the divisions of the trunks of the brachial plexus. Now the chords are going to form from the divisions of this upper, middle and the lower trunks. So how they are going to form, let's see. The anterior division of the upper trunk and the anterior division of the middle trunk both are fused and going to form one lateral cord. The anterior division of the lower cord, it continues as the medial cord, and the posterior division of all the three chords, they are fused to form the posterior chord. So this is how the three chords are going to form. So lateral chord is going to form by the anterior division of the upper trunk and the middle trunk, while the medial chord is going to be formed by the anterior division of the lower trunk, while the posterior chord is going to be formed by the posterior divisions of upper, middle and the lower, all the three trunks. So this is the basic orientation of the brachial plexus. So here one more time for the revision purpose, there are five roots of the brachial plexus. They are going to arise from the ventral rami of the C5, C6, C7, C8 and T1 spinal nerves. The C5 and C6 roots, they are going to fuse and form the upper trunk. C7 continue as the middle trunk and the C8 and T1 continue as the lower trunk. The upper, middle and the lower trunk, they divide into anterior division and posterior division each. The anterior division of the upper trunk and middle trunk both are fused to form the lateral cord, while the anterior division of the lower trunk is continue as the medial cord, while the posterior divisions of all the three trunks, they are fused to form the posterior cords. So this is the basic formation of the brachial plexus. One more important thing to understand regarding this brachial plexus is that we can say up to the trunks, up to here, the brachial plexus, it is situated above the clavicle. So this portion, it is the supraclavicular part. The divisions, they are situated behind the clavicle, and the cords, they are present below the clavicle. So this area, it is the infraclavicular part of the brachial plexus. So the brachial plexus, as we have seen that this is going to arise between the scalenus anterior and scalenus medius muscle of the head and neck. It is going to arise from the five roots, and these roots as well as the trunks, they are situated above the clavicle. So this part of the brachial plexus, it is called as a supraclavicular part. The part of the divisions, they are situated behind the clavicle, and the cords, they are present within the infraclavicular part. And within the infraclavicular area, the cords are situated within the axilla. So we have learned that in our lecture of the axilla that the cords are present within the axilla around the axillary artery. Now the name of these cords within the axilla, they are in relation to the second and the third part of the axillary artery. So suppose when we take a section and this one is the second part or the third part of the axillary artery, the cords are arranged according to their name. If for the orientation, this one is the anterior side and posterior side, and here this one is the medial side and this one is the lateral side, then the medial cord, it is situated somewhere here on the medial side of the second and the third part of the axillary artery, while the lateral cord is situated on the laterally and the posterior cord is situated on the posterior side. And when we see the first part of the axillary artery, the relation of the brachial plexus cords, they are differ. So the movement of the medial cord towards the posterior side, so the movement is just like this. So the posterior cord is situated on the lateral side along with the lateral cord. So posterior and the lateral cords both are lateral to the first part of the axillary artery, and the medial cord, it moves on the posterior to the first part of the axillary artery. So here it is the relation of the brachial plexus to the axillary artery. So very easy to understand. This concept is very important to understand because the questions from the many competitive exams has been asked from this topic, that the relation of the name of the cords, they are in relation to the second and the third part of the axillary artery, while in case of the first part of the axillary artery, the medial cord is situated on the posterior side, while the posterior cord and the lateral cord both are situated on the lateral side. So, and this is because of the lateral rotation, 90-degree lateral rotation of the upper limb during the development. So now let's move on to the branches of the brachial plexus. So for the branches of the brachial plexus, now let's one more time draw the brachial plexus. So this one is the C5, C6, C7, C8 and the T1 roots. The C5 and the C6 root both are going to fuse and form the upper trunk. The middle trunk remains as it is as the C7 root, and the C8 and the T1 both are fused to form the lower trunk. Now upper trunk and the lower trunk both are going to divide into the divisions, the anterior division and the posterior division. This one is the lateral cord formed by the anterior division of the upper and the middle trunk. This one is the medial cord formed by the ventral division or the anterior division of the lower trunk, and here this one is the posterior cord formed by the posterior divisions of the upper, middle as well as the lower trunk. Now let's see the branches of the brachial plexus. We have seen that the roots and the trunks they are present above the clavicle. So let's see the supraclavicular branches first. From the C5 root, the one branch it is going to arise, and that branch it is called as the nerve to rhomboideus. This nerve to rhomboideus it is also called as a dorsal scapular nerve, and this dorsal scapular nerve supplies the rhomboideus major, minor as well as the levator scapulae. The second branch from the root itself is going to arise from the C5 root. It joins by the C6 root and the C7 root, and this branch is called as the long thoracic nerve. And this long thoracic nerve it is the nerve to the serratus anterior muscle, so going to supply the serratus anterior muscle. Other name of this nerve to serratus is the nerve of Bell. Injury to this long thoracic nerve will lead to the winging of the scapula, which we have already studied in our lecture of the serratus anterior. Two more branches are there from the roots, and one of them is from the C5 root itself and going to give twin to the phrenic nerve. So when we see the root value of the phrenic nerve, it is C4, C3, C4 and C5. Out of them, the C5 root, it is from the brachial plexus root of C5. And this phrenic nerve is going to supply the diaphragm muscle. One more branch from the root is from the C5, C6, C7 and the C8 root, and this is going to supply the longus colli and the scalene muscle. So these are the four branches from the roots of the brachial plexus. Now let's see the branches from the trunks of the brachial plexus. There are two branches from the upper trunk only, and one of them is the suprascapular nerve and second one is the nerve to subclavius. The suprascapular nerve supplies the supraspinatus muscle and the infraspinatus muscle, while the nerve to subclavius is going to supply the subclavius muscle. The point here, this is the highlighted point what I want to highlight, and this point it is called as the Erb's point because the injury to the upper trunk is called as the Erb's palsy. Here this Erb's point is going to be formed by the six branches. So if the injury to this area is there, that will lead to the injury to the six nerves, and these six nerves include the two roots of the C5 and C6, one two branches from the upper trunk. One is the suprascapular and one is the nerve to subclavius nerve, and the two divisions of the upper trunk. So these six nerves they are going to be affected when the injury to this point is there, and this point is called as the UBS point. We are going to see the detailed clinical anatomy of the UBS palsy after the completion of this lecture. Now let's see the branches from the chords of the brachial plexus. So after giving the 6 branches from the supraclavicular part of the brachial plexus, as many as 13 branches are going to be provided by the chords of the brachial plexus. So when we see the branches of the lateral cord, the lateral cord gives 3 branches, and the mnemonics for this lateral cord is LML. So one branch, it is the lateral pectoral nerve. Second branch is the musculocutaneous nerve, and the third branch is the lateral root of the median nerve. So here this one is the lateral pectoral nerve. This lateral pectoral nerve supplies the pectoralis major as well as the pectoralis minor muscle. The second branch is this one, and this is the musculocutaneous nerve. This musculocutaneous nerve is going to pierce the coracobrachialis muscle and going to supply the 3 muscles of the anterior compartment of the arm. And these are the coracobrachialis, biceps brachii, and brachialis. So the mnemonics is the BBC. And the third branch of this lateral cord of the brachial plexus is this one, and this one is the lateral root of the median nerve. This lateral root of the median nerve is going to fuse with the medial root of the median nerve, which is one of the branch of the medial cord, and both are going to fuse and form the median nerve. This median nerve is the major nerve from the front for the front of the forearm muscles, and this nerve supply the most of the muscles of the front of the forearm, and that's why this median nerve is also called as the laborer's nerve. Now let's move on to the branches of the medial cord. So the branches of the medial cord, they are 5 in number, and these branches include the medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median nerve, and ulnar nerve. So these are the branches of the medial cord of the brachial plexus. So here this one is the medial pectoral nerve. This medial pectoral nerve also supplies the pectoralis major and pectoralis minor muscle. And this medial pectoral and lateral pectoral nerve both are going to form the loop around the first part of the axillary artery. So suppose here this one is the axillary artery. The medial pectoral nerve comes from the medial side, and the lateral pectoral nerve comes from the lateral side, and both are going to form the loop in front of this first part of the axillary artery. The second branch of this medial cord is the medial cutaneous nerve of arm. And the third branch is this one, and this one is the medial cutaneous branch of forearm. So both of these branches, they are going to supply the skin of the medial part of the arm and the medial part of the forearm. So medial cutaneous nerve of arm is little thinner one, and medial cutaneous nerve of forearm is little thicker one to supply the skin of the forearm, which is situated distal to the arm. Now the fourth branch of this medial cord is this one, and this one is the medial root of the median nerve. So here the lateral root of median nerve and the medial root of the median nerve both are fused and form the median nerve proper. And the fifth branch of this medial cord is this one, and this one is the ulnar nerve. So ulnar nerve is the largest branch of the medial cord and which is going to supply the most of the intrinsic muscles of the hand. And that's why the fine movement of the hand is regulated by this ulnar nerve, and that's why the ulnar nerve is also called as the musician's nerve. So these are the five branches of the medial cord, and the mnemonics for the five branches of the median cord is M4U. And as we have discussed, the mnemonics for the lateral cord was LML. Now let's move on to the branches of the posterior cord. So the posterior cord of the brachial plexus also provide five branches, and these are the upper subscapular nerve, the lower subscapular nerve, nerve to latissimus dorsi, one is the axillary nerve, and the largest branch is the radial nerve. So the five branches from the posterior cord of the brachial plexus are there, and this one is the first one, that is the upper subscapular nerve, and just near to it there is a lower subscapular nerve. This upper subscapular nerve, it provides nerve supply to the subscapularis muscle, and the lower subscapular nerve, it also provides nerve supply to the subscapularis muscle, but along with that it also provides nerve supply to the teres major muscle. A third branch of the posterior cord of the brachial plexus is this nerve to latissimus dorsi muscle. The nerve itself, name suggests, it is going to supply the latissimus dorsi. The other name of this nerve is the thoracodorsal nerve. And the two larger branches of this posterior cord, one of them is this one, and this is the axillary nerve. This axillary nerve is going to pass on the posterior side, and it is going to wrap around the surgical neck of the humerus and going to supply the deltoid muscle, and along with the deltoid muscle this axillary nerve also supply the teres minor muscle. And the largest branch of the posterior cord is this one, and this one is the radial nerve. The radial nerve is the largest among the all branches of the brachial plexus, and this radial nerve is also passes on the posterior side of the humerus and run within the radial groove of the humerus and going to supply the posterior compartment of the arm as well as the posterior compartment of the forearm muscles. So here the mnemonics for the posterior cord of the brachial plexus is the ULNAR. Here the U for the upper subscapular nerve, L for the lower subscapular nerve, N for the nerve to latissimus dorsi, A for the axillary nerve, and R for the radial nerve. So all these are the 17 branches of the brachial plexus which we have learned in a nutshell. So for the root value purpose, let's move on to the root values of the branches, and these are important to understand that if the branch is going to arise from the particular root, they having the root value from where this nerve is going to arise. So for example, nerve to rhomboideus having the root value of C5 only, while the long thoracic nerve having root value of C5, C6 and C7 because it is going to arise from the C5, C6 and C7 roots. While when we see the branches of the trunk, so suprascapular and the nerve to subclavius, both are going to arise from the upper trunk, and the upper trunk is going to be formed by the roots of the C5 and C6, and that's why the root value of both these upper trunk branches, they are C5 and C6. So when the upper trunk injury is there, the root C5 and the C6 roots are going to be involved. When we see the branches of the lateral cord is going to be formed by the ventral division, or we can say anterior division of the upper trunk and the middle trunk. The root value of this lateral cord branches, they are C5, C6 and C7. And this medial cord is going to be formed by the lower trunk anterior division only, and that's why the most of the branches of the medial cord having the root value of C8 and T1. The ulnar nerve is the only exception of the medial cord that having the root value of C7, C8 and T1. The C7 root of the ulnar nerve, it is going to be provided by the lateral root of the median nerve, and the C7 root is going to supply the 1.5 muscle of the front of the forearm. This is the medial part of the flexor digitorum profundus and the flexor carpi ulnaris muscle. So this 1.5 muscle of the front of the forearm, it is going to be supplied by the ulnar nerve and via the C7 root, which is actually provided by the median nerve to the ulnar nerve. When we see the root value of the median nerve, it is actually the all the roots they are going to be form the median nerve, and these are the C5 to T1. Same like that, the radial nerve is the thickest nerve and having the root value of C5 to T1 all the roots, while the axillary nerve it is situated on the upper part and having the root value of C5 and C6 only. The subscapular nerve, both the subscapular nerve having the root value of C5 and C6. While the root value of this latissimus dorsi is the C6, C7 and C8, and this is little awkward root value among all the nerves, so you can remember it as a special root value that C6, C7, C8 is the only root value for the nerve to latissimus dorsi. So this is all about the branches of the brachial plexus. Now in the next session, we will move on to the clinical anatomy concerned with this brachial plexus. So for this much important information, you may have many MCQs in your competitive examination, or you can write the short note in your theory exam also. This is the frequently asked short note or the full question in case of any examination. In the next session, we are going to see the clinical anatomy concerned with this brachial plexus. So this is all about the normal anatomy of the brachial plexus. Hope you understand well. Thanks for watching.